Well, good morning, everyone, and it's a pleasure to be invited to participate on this call. My name is Kaye Phillips. As I mentioned, I am a director here at Health Standards Organization. And for those of you who might not be familiar with our group, we are Canadian-based, but a global non-for-profit that develops and delivers standards assessment programs and different types of resources and training to support health and social service providers to drive improvements and enhance performance. Really, at the heart of our organization is our CEO Leslie Thompson, former CEO also at Kingston General, and she's really helping us lead in the last year or two in really driving this mission that's about unleashing the power and potential of people around our world who share a passion for achieving quality health services for all. So what we do is a whole mandate of programs that co-create products and services that we strive to be relevant, rigorous, and results-oriented. We have quite a large mandate that places people and families and community members at the heart of our design. So we have a co-design philosophy in our operations. And over the years, you may be familiar with Accreditation Canada. Well, they're one of our key organizations that are a part of our umbrella. HSO has really come to life in the last year and a half, and we've done more of a soft launch. But we have over 1,600 clients using our standards and assessments around the world, including individual organizations and health regions and governments and accrediting bodies, and over 1,000 health and social service organizations and 7,000 sites that have been accredited through our Accreditation Canada program and services over the last 30 years. And so that's just a little bit about HSO and who we are. And why I'm here today is to share with you essentially a initiative that we've been working on over the last month and a bit with Lisa and the CAPHC group, as well as Accreditation Canada and a number of other partners who I'll share with you. That's a submission to Health Canada's, it's called the HCPC program, that's focused on improving integrated care for youth, child and youth in mental health and social services. So today I just wanted to have an opportunity, and thank you, Lisa, for this, to give you a brief overview of some of the proposal highlights and what we have put forward as of this past Friday. And as I know, a number of you received some communication on the initiative, and we thought we could open it up to some reflections or questions, and happy to keep you posted as we hear more about the status of the proposal. So as I mentioned today, it's just a bit of an overview. I'll speak a little bit to the context of why the initiative, but obviously all of your organizations are very familiar with the data and the prevalence of youth and mental health needs and conditions, and why this type of integration is required. I mean, that is the heart of this community of practice as well. I'll get to some of the key objectives and activities that we've proposed within the proposal and the timelines. And as mentioned, hope to have some time for reflection and discussion. So just a quick overview then of the Health Canada funding envelope that we applied for. We submitted our first letter of intent back in February, and we received notice in July that we were successful in moving forward to a full proposal. So that's what I led the development of, and with great support with Lisa, a whole team here within HSO and Accreditation Canada, and as I mentioned, a number of other partners who were great in providing input and focus along the way in a short order, but I think we're really excited and I'm pleased with the product we've delivered. Essentially, this program we've applied to it provides time-limited contribution funding for projects that are about improving accessibility, quality, sustainability, and accountability. And really the objective of this stream we looked at was promoting the integration of community health services with primary care. And you'll see in the focus of the proposal that we really drew that out to ensure that we're talking about integration where we know what's needed in both health and social services. So that's the heart of it. And I apologize for that hanging clause there. In terms of the context itself, as I mentioned, you are all very familiar with prevalence of the number around 1.2 million Canadian children and youth affected by mental health conditions. That really, at the heart of it is, by the age of 25, that about 20% of Canadians will have developed said conditions, yet less than 20 are actually receiving the appropriate treatments. We know that suicide prevalence among 15 to 24-year-olds is the second leading cause of death in youth in Canada, and that amongst that population, there really is a vulnerable group. Youth living in lowest income neighborhoods, highest rates of suicides, emergency department visits for deliberate self-harms, and also acute care mental health service use. In the proposal, we highlighted these obviously types of facts of what we know, both in terms of vulnerable populations and high-risk populations when it comes to First Nations youth, knowing that our suicide rates about 5 to 6 more times more than non-Aboriginal youth, as well as for the LGBTQ youth community, who face up to 14 times the risk of suicide and substance abuse than their heterosexual peers. And then another key population risk population we highlighted in the proposal was for youth populations of mental health issues, for refugee children and youth, those who have unique factors, whether it be not being able to speak the same language as their peers, exposure to violence in their countries, or separation from family members. And so that was that's just to give you a bit of a highlight of some of the, what we know about the risk population group that we're talking about, and the youth and children we're speaking about. And in terms of supports, we know that youth who are engaged in child and adolescent mental health services, that they require person-centered and continued services. And particularly, and I have heard it in a number of the initiatives you're leading, as they prepare for transitions to adult mental health. But one of the barriers we're aware of is the current fragmentation across continuity of care. And so that was the crux of this proposal, really. Improving integrated child and youth health and social service care and supports. So let's get to the heart of it then. The IICY initiative, which is right now what the acronym reads, really the mission is about improving the continuity and appropriateness of care and support services for youth with mental health conditions through community mental health, acute primary care, and social service integration. And in building up this proposal and working with CAPHC and Lisa and our team internally, and then other partners who have, and advisors providing input along the way. Really, the premise is that we want to be supporting this through evidence-based practices and standards, a co-design approach where youth, family, and organizations, subject matter experts, and kind of the policy leaders are a part of that design, which we know takes time, takes really strategic and focused engagement, and a part of that is innovating ways for that multi-sector collaboration, that the partnerships and leveraging the great work that's underway already across provinces and in some case national organizations, that we wanted to leverage the resources and the strengths and even some of the initiatives already underway. And with that, that emphasis on knowledge translation and exchange through communities like yourselves. And key to all of it too, of course, is right from the get-go the design of a evaluation and performance measurement approach that will be reflective of common short to longer term outcomes that and a pathway, a journey that we would want to see as we move towards our mission. So that's kind of some of the aspiration parts. In terms of the key activities themselves within the proposal, this is more of a highlight, but we've framed it as a suite, a solution that has a number of key activities. And the first part of this 3-year initiative that we've proposed is the development of what we're calling standards and publicly available specifications. And publicly available specifications are newer to HSO. We're in the business of standards. They usually take all is said and done. We have a rigorous methodology using technical committees and working groups and building our standards. But I'm just received some music there. Are you still there, Lisa?
I'm still here.
Okay, great. Um, our publicly available specification, our passes, is an approach that streamlines the standard development. It still uses a methodology that involves technical committee subject matter expertise in development, but it's a streamlined timeline that really builds the seed for moving better standards into practice quicker while giving that time for development. So this initiative brings to the table standard and pass development and licensing for child and youth mental health passes, suicide prevention safety intervention standards, what we're calling health and social service network provider, and health and social service networks passes, as well as child, youth, and family services standards. And really, this is again ensuring that have the right in having the right technical expertise and building and developing this package of standards that would then be turned into what a program of HSO is called a recognition program. And that recognition program essentially takes the 4 or 5 different standards and passes and customizes it for the objectives that this IICI would want to fulfill. So it would build essentially a one standardized document with an assessment and maturity indices manual that would support this. And all of this, content development would be navigated through the launch and delivery of what we're calling the IICY collaborative, and that would start around year 2. And this collaborative, the proposal would be about 2 phases, whereby we would put a call out across the country to what we're calling network champions, and they would be health and or social service organizations who put their hand up and want to step forward as what we're calling champions in building a network over a 2-year time that will work together in a collaborative manner and a part of more of this national collaborative on a journey towards enhanced integration. So that first year would really be supporting these network champions through, again, a community practice like this that has a combination of, a webinar series, education and training against the standards and against the processes that have been developed, as well as then readying the field for building out the network, identifying key additional service providers and healthcare providers that would form this larger network within their ecosystem. And that would be a part of phase 2, is that each of the network champions would then have this support, this network developed and working together towards enhanced integration. And a part of that is the network teams, by the end of it, would be supported along the journey towards one of HSO's programs called Recognition Program, whereby teams would then be assessed. They would do self-assessment, as well as there would be external assessments that would come in and help to really understand on this journey towards enhancement where you are along the continuum of achieving integration. This would all be coupled again with different knowledge translation, knowledge exchange opportunities. As an example, what we're calling the Policy to Practice Symposium, where at the beginning of the collaborative, we would have a kickoff symposium bringing all of the network champions together, as well as key partners and stakeholders in the field, and some policy decision makers, as well as what we're calling at the end of it a sustainability symposium. And this is about, everyone will be on a different maturity indices or a different journey. What are the next steps in an action plan for sustainability? And so that's essentially, just in a nutshell, some of the key activities that we're putting to the table. As you see, we've built out a logic model that articulates our different outputs and some of the outcomes that we would anticipate to see over the short to longer term. And really, this, as I mentioned, is about a co-designed collaborative approach. A part of the incentive and of participating network champions would be receiving funding to support this. We've put forward up to $60,000 in funding for these champions to administer and to build out the network work over the 2 years. And key to this, as I mentioned, is the work as well with partners across the country. So on the proposal, we have organizations, obviously Lisa and CAPHC, and right behind us, Frame, who's a fantastic child and youth integration and knowledge exchange network internationally, a part of the NCE, Canadian Foundation for Healthcare Improvement, who's doing great work in suicide prevention and work in the North. HUCC is right behind us, as is their youth council, and they're really keen to have youth a part of the whole standard design, as well as even potentially some of the surveyors who are supporting the recognition approach. CMHA, CCSA, Canada Health InfoWay, amongst others, are all signed letters of support, and upon success, will be provide different types of in-kind resources and collaboration. So that is essentially it in a nutshell. I've articulated here some of the outcomes that we would anticipate to see over time. Of course, knowing that once we hear status of the proposal, which should be by end of December, we'll have about 3 months to really nail down our work plan, our final, evaluation performance measurement plan against the outcomes that a group of faculty and technical committee members will really, and partners will help finalize. But I think we've made some great headway in the proposal. We have a roadmap for, we're anticipating that we haven't heard from Health Canada when we'll hear the announcement and or when the funding will start. So we based everything on the government's fiscal year. So really, if it is hypothetical, but we had to, without that information, we started somewhere. I am assuming this, if we get the funding, would start up April 1, 2019 and lead us over a 3-year journey. So that is essentially the heart of it. I'm going to stop there, and I would look forward to any of your reflections or questions or comments on what we've put forward, and yeah, open to feedback. Thank you.
Thanks so much, Kaye. Just want to put it out there for anybody. Any thoughts or any comments about this proposal and the work that is already underway in sort of your environments? I think that all the provinces are moving towards some integrated networks and trying to support that in some ways. So how does this sort of dovetail with some of the work that you're aware of, or any thoughts, really?
Hi, it's Linda in St. John's. I was really interested to hear what you had to say, Kaye. As I mentioned at the beginning, here in Newfoundland and Labrador, we're working on integrated service delivery, and that's for children ages 0 to 25. And we've had a lot of contact with Frame, with Ian Mannion, and also with others across the country, Youth Wellness Hubs, Foundry in BC, Access Open Minds as well. So it sounds like, very similar work is happening there. So I wondered how much connection do you have with those other sites across the country that are doing integrated service delivery?
Yeah, thank you very much, Linda, for that question. That's precisely in the last month and a half or so, as we worked with Ian, actually, in some preliminary conversations. We're, as an example, committed to, as part of our next steps forward, committing to leveraging both of our strengths and collaborating in a way that helps contribute to the gaps that we have. As an example, HSO really our mainstay and our strengths has been in our standard and assessment development over the last 30 years, and that's one of the strengths we're bringing to the table. The likes of Frame and some of the OCE initiatives, say for instance, as a provincial example, we really see that opportunity to use this as an initiative to test out some of the standards and the best practices and assessments that are going on in the likes of Frames and their step pathway as an example, and you and have an opportunity to collaborate and do some testing.
That's great. I just wanted to mention, and maybe, Kay, we can speak offline so I don't take up too much time and let other people speak. We are also working here on creating provincial standards for youth transitioning into adulthood, and be very interested in talking to you about any work that you guys have done on that.
Great, absolutely. Absolutely, Linda. Thank you.
So any other thoughts out there? Any other?
Hello.
Hello?
Hi, this is Deborah Pace. I was interested, you did mention some of the stats related to First Nations in Canada as it relates to suicide and substance abuse. I'm wondering, are you capturing any of the First Nations in this study as an initiative to develop pathways for them?
That's a great point and question, and the reason why I did highlight as an example First Nations youth as well as refugee and the LGBTQ community is because when we're not being prescriptive, Deborah, in the youth population that the champion sites focus on. The idea is that we have champion sites that will, that first year, they're working towards using their data to and their knowledge and experience to identify with evidence the target population that has the highest prevalence and or is in the most need, and that we're essentially we're a part of the framing is that we will want sites to make sure that the vulnerable populations are a part of their target, but we're not being prescriptive on that. So we certainly will want to, and I particularly envision that we will have champion sites that will identify First Nations children and youth as a high priority population. And as I mentioned during my presentation, actually I just started at HSO 6 months ago. Before that, I was with an organization, Canadian Foundation for Healthcare Improvement, for 10 years, leading pan-Canadian and provincial collaboratives on innovation and improvement. And right now, CFHI has an initiative working with the northern provinces on First Nation suicide, and we've a part of this initiative is also, you know, leveraging and working with them on some of the work that they've already started up and how we can bring that to other sites as well. So definitely I do see a focus. We're not being prescriptive, however, in what populations each site chooses, if that makes sense.
Okay, that sounds good.
Yeah, so I think that as champion sites or you know are identified, there'll be some criteria. They'll need to have a bit of their network already in place. And as you, like I've heard, you know, Lindsay has described your program and the services out there, and you know, I could see that being, I could see Healthy Child, Healthy Minds being, you know, leading one of these networks. So I think it's just whoever can sort of come forward, say that they're committed to leading this work and developing and nurturing their network and implementing some sort of pathways. You have some proven tools already, and I think that this sort of helps to this initiative would really help to validate tools that might already be in use as well. So it's not about developing something new all the time. It's about testing and validating what's already out there and just building those networks in a more precise way, you know, sort of using those standards or yeah, the HSO standards to measure and to guide. So.
Yeah, that's a great point. Thank you, Lee. So that's precisely it. This is very much also a part of the, it will be about exchange and using the validated or testing tools in some cases, and using existing work that has already been done. It's not about reinventing the wheel here, that's for sure.
So Heidi or Nancy, as as Holland Bloorview is sort of coming into the mental health work in sort of a more focused way, do you see this? I know that Holland Bloorview is part of Kids Health Alliance, and you do have your sort of networks within the urban environment, and I'm sure that it sort of transcends out more rurally as well with a lot of your patient population. Is this something that you can see working, and I know in Ontario there are also the sort of the integrated mental health hubs, and I don't know if you're part of those, but is this something that you could see working in your sort of environment?
Can you hear me? I'm on the phone. I can't tell if it's muted or not. I'm hoping it's not.
It's not. I can hear you.
Okay. I had to turn off the audio on the computer. Thank you for that suggestion, Lisa, because it wasn't coming through. I can't speak to the mental health services here. We're sort of out. We're on the circumference of that group, but we do have ties with the Moving on Mental Health Initiative through a healthcare partnership table, where we are sitting at that table and trying to make connections and partnerships and hopefully pathways where we can access, or some of our clients and families can access, more intense mental health issues. What we're trying to deal with here is more of increasing the awareness of our clinicians to the mental health challenges and supporting some of the more basic services that we can with our current staff, but also trying to make those linkages and resource connections with others. So this is something that sounds very interesting for us as well.
Great. So it seems like lots of potential. So
Yeah.
I don't think we'll have, we won't run the risk of nobody wanting to be involved. So.
Great.
So I think a couple of people joined on the line while we were talking. So Bev, did you want to just say hello and where you're from?
Sure. Yeah, no, that I was listening in. I came in a little late, but that just sounds very interesting. It's looking across all services and all ages, and yeah, I was listening with great interest.
Great. Okay. Any other thoughts or
And
comments?
sorry, Bev, where is it that you're joining from?
Oh, Bev?
Yes.
Can you just let us know where you're joining from? Sorry about that.
From Edmonton.
Yeah.
Great.
Okay. Any others? I know some people have just had to leave as well. So any other thoughts or comments, or any hesitations or cautions? I think a lot of this, as it's a very strong proposal, has some really great partners involved. So I'll go on we'll just be positive here and say, so when it gets accepted and funded, I think there'll be a lot of boots on the ground at that time to just get everything up and rolling. So I think we have a lot of support from some really important organizations and associations who each bring some different expertise, like HSO and the standards development, CAPHC sort of community building and knowledge translation, frame with their sort of integrated networks approach, and mental health commission. So a lot of expertise, a lot of subject matter expertise, and a lot of specific skills that are really going to be needed to make this work. So I'm pretty confident and excited about the prospects. So,
Hi, it's Linda again. You may have said it, Kay, and I missed it. What's your timeline if for getting word on whether this is accepted and moving it forward?
The Health Canada has kept that a bit loose. In the response, it was the next several months. So I'm anticipating that by December 1, we should know. And as I said, in my mind, and having worked with Health Canada for a number of years, that will probably mean a pretty quick startup. So usually they take a little bit of time for that assessment, and fair enough in terms of what they're going to fund. This initiative we put forward for $1.5 million overall, and for the proposal, and I anticipate December we'll hear, with a startup at the beginning of April 1st, 2019 is my hypothesis.
Thank you.
Great. So thanks, Kay, for all that information. And for those who weren't able to join through the web meeting, it has been recorded. And also I'll ask Kay to share the slides with me if you're unable to view the recording. So, but we will post the recording on our mental health COP page. And I'll send that link out to everybody. All right, so we don't really have much else on the agenda. I just wanted to know if anybody has any updates from things that are happening in your programs or in your neck of the woods, and or if you have any questions to send out to the group. Pretty. Nothing new going on?
Hi, Linda again.
Yeah.
There's so much new happening here. I mean, I'm brand new to this group, and I could spend like days telling you about stuff, but I just wanted to say thank you, Lisa, for allowing me to be a part of this group, and I hope to be able to make some good contributions over time.
Oh, no, it's great. And it's always good to hear from all parts of the country, to hear what's going on. And so next month we will have a presentation from Cindy Lucas, and she'll be talking a bit about child and youth mental health and substance use collaborative in BC, and how they use that method in Alberta, actually. So some more. I think we all see the trend here, that it's all about collaboration and integration. So I think that's going to be our focus of this group, and how to better support all of that collaboration and networking and integrated services. So I think it's preaching to the converted here. So just learning a little bit more about how it works in different environments. So the same concepts, but a little bit different application, I think. So if nobody has any final word, go ahead.
Sorry, this is Bev from Edmonton, and I was just curious if anybody knows anything. We tried something new here this summer, at least in Edmonton, where we have pretty good programming for youth with severe psychiatric disorders, sort of ongoing all year, but there's little to no. We had little to no support in terms of programming in the summertime, and so we were sort of charged to try and see what the response would be to ongoing summer programming. Despite everybody saying, well, nobody wants to come to a summer program in the summer, they want to just be hanging out at home. And so we did this small little pilot with, of course, no funding, but just sort of off the side of our desk. And we were surprised and really sort of humbled by the 10 youth that attended for 6 weeks, 3 days a week for 6 hours a day, and
Wow.
made a huge impact on me. We're just still working on the evaluations, and but these would be kids who might be waiting for programs to come in the fall, had been discharged from acute care hospital, because they were over the crisis. But the kids showed up. They got there on their own, and it was we were pretty impressed. And it was really, we went to our family youth advisory group and sort of asked them what they thought. And of the 4 youth that were there, they were they absolutely said they would come. They said they're so lost after you've been in hospital. So that was really interesting. And I'm just wondering. I did do a little bit of a lit search, but of course we put this together fairly quickly. But I'll share some of our findings with the group if people are interested.
Sounds awesome.
I would totally love to see any of that, Bev. That'd be amazing. I know certainly here with integrated service delivery, and you'll find that with youth wellness and Foundry and other places. I mean, if the space is right for young people in terms of a youth-friendly environment, a welcoming environment, I think it doesn't matter what time of year. You may get fewer numbers for sure, but you'll definitely get some young people come out, because it'll be a place that they'll be telling people about and saying, come on over, we're going to do this activity.
Yeah, and it was actually a couple of the youth will be almost 18 next year, so they're expressing some interest in coming back as peer support. So we were just sort of surprised, considering like I said, we had no budget and we had about 4 people to put it together, and and the parents were just over. Well, that was free, of course. It was low barriers, but anyways, I will share that with people. But this idea that things are better in the summer for people with a mental health is even though I know school is a great stress, but it was very interesting for us.
So Bev, it's Lisa. Can I just ask? So what was the age group of the?
Mostly adolescents. So we were looking at that 12 to 18, 13 to 18 age group.
Okay. And what did the programming? What was it based? Like, what sort of programming was it?
So it was like they came from 10 till 3, and they did sort of a morning check-in. They had we did do one type of sort of psycho educational group or mindfulness, and we didn't do any sort of individual one-to-one things, but sort of goal setting and mindfulness. And then we tried to introduce some skill buildings, like some resume building. We worked on. We had people come from the community that opened up the ideas to the community about volunteering and getting involved, and they went to. We had a local gymnasium that offered them a fitness hour of fitness once a week, and gave them some individual programmings. And then they had a community outing once a week, where they went out into Edmonton and explored inexpensive, enjoyable things to do. So it was sort of, there was some skill building, recreational, and socializing.
Wonderful.
Yeah.
Awesome.
Was this a mixed gender?
Yep.
Excellent.
Yeah, and really, sadly, it came out of really a quality review of 2 really significant events that occurred with kids post-discharge in the summer months. So that was sort of the push for it. But and I have to say, there was quite a few people, lots of naysayers, lots of professionals who didn't think it would work, didn't think people would come, and so we didn't know what to expect. And then at the end of the summer, we had a barbecue and invited the families and the people who had supported it. And we had something like 45 people come out. All the parents came out, so it was really surprising, and we were really impressed with the youth.
Nice.
That's wonderful, Beth. I'm wondering if maybe you'd like to do, maybe offline we can talk about maybe doing a bit of a presentation about that.
Yeah, for sure. And actually, the U of A Faculty of Nursing is looking at it from an evaluation point of view too with us from a different perspective around providing nursing with student nurses with an opportunity to have a preceptor with that. So that was another really interesting spin-off from that.
Yeah, the needs don't stop just because the sun comes out.
Yeah.
Mm-hmm.
Yeah.
It's Linda again. I wonder, Bev, any thought about doing something like that for kids who aren't in school? Like I used to work at a community agency here that serves 16 to 29-year-olds.
Mm-hmm.
And certainly they had recreation programs and things like that in the summer that young people responded well to because it was kind of quote unquote normal things to do as opposed to being problem saturated.
Mm-hmm. Yeah, and I mean they did have. Sorry, Linda, are you saying did they have quite a bit of sort of not unstructured time?
No, I was thinking, just asking about providing that type of programming for kids who aren't in school.
Oh, aren't in school? Yes, yeah, that might be someplace that we'll go there. We also have in Edmonton. There's a youth group called Challenge by Choice that runs. I think 6 days a week, and it's there's a lot of kids who aren't in school who are involved in that program as well. We really focused on this was really focused on the kids who had been discharged from hospital, and we were those kids that we were really concerned about that for this particular little pilot.
That's great. Yeah, obviously a big need there.
Yeah, and some of our families were much more, so many families are so concerned to go home, and this was a really nice offer to say, listen, that we'll still support them, and then we did have the psychiatric support, so that if there was kids that went into crisis, that we had that backup, and we had a couple kids who had some difficulties, and that we were glad that we had sort of daily contact with them. And could support them as they transitioned out. But yeah, Lisa, once I get things put together, I could send you some information and see what the interest is.
Yeah, that would be great. And that's what it is. You develop this program, then people hear about it, and they can try it in their own context. So
Yeah.
Thanks so much, everybody, for sharing your thoughts and your questions and the discussion. And thank you to Kaye for telling us all about the proposal. And good luck to all of us for success on that proposal. And we will talk again soon. And I'll send an email with a link to the presentation and a copy of the slides and a bit of a description of Cindy's presentation next month. So thanks, everybody.
Thank you.
Thanks.
Thanks,
Bye.
Lisa.
Bye. Thank you very much.
Thank you. Bye-bye.
Bye.